One study that was described as dishonest, unethical, irresponsible, and callous by the United Kingdom medical regulator has brought back a childhood disease that was in the year 2000 declared eradicated in the United States. Welcome to online medical research. Well, although the truth is out there, it can be challenging to be found. In one study, the Wakefield study, the pendulum has swung from disease being defeated and completely eradicated to making a dangerous comeback. The medical field needs to get aggressive on getting the true information out there to discredit this report and let concerned parents know that the results are false and it is far safer for their children to be immunized. I suggest that we start with the pediatric offices and the OB/GYN, the educated caregivers giving them the education the parents need. My name is Carla Bennett, and I'm happy to discuss this with you today. The United States got aggressive on eliminating measles by promoting what is called the MMR vaccination in 1963. MMR stands for measles, mumps, and rubella. Reported by J. Lobo in 2016 in their report vindicating the vaccine, 500,000 cases of measles were reported to the CDC each year. Of that number, 48,000 were hospitalized. 1,000 developed what is called encephalitis, which is brain swelling, and 400 to 500 cases resulted in death. Lobo went on to state that the MMR vaccine is credited with preventing, since that time, 52 million cases, 5,200 deaths, and 17,400 cases of mental retardation in the first 20 years that this vaccine was used in the United States. Because of the aggressive promotion of the MMR vaccine in the year 2000, the CDC declared measles completely eradicated in the United States. Now fast forward to 2019, the highest reported numbers of measles has occurred in 25 years. What happened? The Wakefield paper. It was published in The Lancet in 1998. In this paper, 12 children were linked to contracting autism after receiving the MMR vaccine. The finding of this paper concluded that if 3 strains of the viruses in the MMR was used, that the child's bodies could handle it better as opposed to the 3-in-1 that was routinely given before. The suggestion was to have the vaccine broken into 3 separate ones. Before this study, from 1963 to 1998, there were no concerns or lengths of vaccines during autism. This caused a major backlash in the parenting community. Concern for their children and the risk of contacting autism caused many parents to stop immunization schedules, and they actually stopped going to pediatric visits to avoid the debate with the pediatricians. During this study, herd immunity, which is so vital on communities, it started to disappear. I'm sure you've been hearing about herd immunity with the scare and the pandemic of the COVID-19. Herd immunity is a buildup in a large population of a community to be immune to a disease. They can either become immune due to contracting it themselves or through vaccination. The key of herd immunity is it helps to protect the ones who are at most risk who cannot receive immunization, and it would be dangerous to contract the disease. That would be the elderly, the very young, or the compromised immunities. The ideal amount of community to have herd immunity to protect from measles is 95%, according to Taylor, Lingham, Simmons, Stoll, and Miller. If the number slips below this, the advantage disappears. As the news of the Wakefield study grew on social media and was quoted again and again and again, several areas dipped below this line. Some areas in California went below 85%. During this time, there was an actual outbreak in Disneyland that spread over 8 states. The CDC reports that from January 1st to October 1st in 2019, 1,249 cases of measles was reported. The National Institute of Health cites an occurrence of an oncology treatment center where one child having a case of measles infected 23 other children, and there was a fatality rate of 21%. But what do you do as a parent? Who do you trust? Would you risk your child getting autism? Would you take that chance with what's considered a childhood disease? The numbers aren't that bad. The truth needs to get out there. J. Lobo goes on in the report to say this Wakefield study that triggered all the fears, only 12 children were in this study. Of the 12, 9 were showing signs and symptoms of autism before they ever received the vaccine. The funding for this Wakefield study was lawyers. They were trying to create lawsuits. The lead investigator, the lead physician, Wakefield, he had a patent for a new vaccine using 3 separate strains instead of 3 in 1. Since that time, with extreme research in the United Kingdom following up and calling him so many names, there were 13 people who actually created the study. 12 have recanted their numbers because of the questionable ethics behind it. Since that time, there have been many studies refuting the link of autism with MMR. There was one study that had over 100,000 children, not one link. In the Australian Nursing Journal in 2004, they said that it was retracted. The United General Medical Council, after the longest ever inquiry, described Wakefield and his study as dishonest, unethical, irresponsible, and callous. Unfortunately, bad news sells way quicker than good news or facts. There are way too many links and way too many spin-offs. The fear is out there. It is undermining the effectiveness of an immunization that has protected children for over 47 years. The CDC, always transparent on their numbers, on their website posts the risks of an MMR vaccine. 1 out of 6 could have a mild fever. 1 out of 20 could have a rash. 1 out of 75 might get swollen glands in their cheek or neck. 1 out of 3,000 run the risk of a high fever that, if not cared for, could result in seizures. They now offer a vaccine that has, they call it the MMRV. It is measles, mumps, rubella, and varicella vaccine. Varicella is what causes chicken pox. This is something that if a child never gets, they'll never have shingles. These are key things. What can we do? We need to get aggressive. We need to campaign as hard as Wakefield did. We need to get the information in the parents' hands. I recommend we start at the OB office. We get the paperwork, we get the professionals talking to the parents, discrediting this and getting them to